And unlike some of our viewers, because I've got a particularly cheeky question that has come in from someone called Claire, who says, do 65-year-olds who are star sign Leo and cycle or skydive tend to recover badly from partial knee replacements? She says she's asking for a friend.
Yeah, so
I wouldn't call her a friend myself. She's my wife.
No, well, clearly, is it Claire though?
Claire, yeah.
So Claire is a Leo who does skydiving.
No, I'm the Leo.
Oh, I see. Okay, right. Okay. So the answer is yes. I mean, I think that they are a very good option. And we've talked about suitability, and I think that when we look at 100 patients, okay, about 40% will be suitable for a partial. And to be honest, that's probably the big thing we need to address in the UK right now, because 8% are actually getting partials. And there are surgeons who are knee surgeons who don't do partials at all, because they say, I just don't think they're very good, or I haven't had the training. And so, like you say, it's very difficult to start. You know, if you know you can do a total knee, it's very difficult to change. It's a big education thing for us within knee surgery.
You said a partial is more complex than a total knee replacement. Does that mean they are correspondingly more expensive for whoever's doing it?
No. So they're not. They're actually cheaper. So if you were doing a partial under that same arrangement I talked about, a total knee being about 16 or 17,000, a partial is about 14,000, which breaks my heart, obviously, because it's cheaper. But it's more modern, it's more sexy. And the reason is because you're out of hospital so quickly.
Right. Yeah.
So that's why it cuts the cost down. Again, so that would be a huge advantage for the NHS if they were doing all of these as day case. Suddenly knee replacement becomes day case very reliably. And we are beginning to do day case total knee surgery, but we need a lot of support, a lot of home care to be able to do that.